Hello, I'm Dr. Julio Montaner. I'm the director of the BC Center for Excellence in HIV/AIDS. I am pleased to welcome you today to the first session of the HIV Continuum Care Collaborative, and I'm really sorry I cannot be here with you today. This new collaborative marks an exciting development in our effort to end HIV in BC. Working together, we can close the gaps along the HIV continuum of care, as well as build capacity and create a lasting legacy of quality improvement in the province. Here in British Columbia, we are at the leading edge of the fight against HIV and AIDS. Our work has left little doubt that what action needs to be taken to bring the epidemic under control. In short, we need to identify those living with HIV and promote and support their engagement into life-saving treatment and care on a sustained basis. This will ensure improved health outcomes for the individual and simultaneously a decrease in HIV transmission in our communities. We took major steps in this province when we first launched the Stop HIV/AIDS initiative. The pilot project studying the impact of expanding access to HIV testing and treatment among hard-to-reach populations and vulnerable populations in Vancouver's downtown east side and Prince George was extremely successful. The successes that we achieved together under this pilot allowed the Minister of Health to expand the initiative province-wide earlier this year. It is therefore fitting that this first learning session is hosted by our colleagues in Prince George, who play a key role in the earlier phase of the pilot. Let us now take the lessons that we learned under the STOP pilot and apply them throughout the province to all of our communities. To do so will require both collaboration and focus. Ultimately, we will provide the best evidence-based treatment and management and care for the benefit of all British Columbians. Research has been and continues to be at the foundation of our strategy and guides our actions today. The BC Center has shown treatment as prevention, which involves expanded access to the HIV test and HAART, plays a critical role in reducing HIV-related morbidity and mortality, while at the same time reducing the transmission of HIV in a regional population. As a result of the province's unwavering support of this strategy, BC has demonstrated a significant decrease in HIV morbidity and mortality, as well as a consistent decline in new HIV diagnoses. Notably, we are the only province in Canada that has implemented this strategy. And not by chance, we are the only province in Canada with a continued decrease in new HIV diagnoses. In fact, we have shown that the treatment as prevention is not only valuable to the HIV-infected individual, but it is also valuable as a public health strategy because it contains the spread of the HIV. And taken together, as a result, this is a cost-averting strategy. Indeed, HIV treatment as prevention saves lives, prevents infections, and saves money. While our own federal government has failed to jump on board, the global community is recognizing our accomplishments and following our lead. In the past year alone, the World Health Organization fully incorporated treatment as prevention within their new global HIV treatment guidelines. Earlier this year, France and Brazil announced plans to adopt our strategy as part of their national policies, following the earlier lead of China and the USA. However, despite our successes to date, much work remains to be done. Today, approximately 60% of the people living with HIV in BC are accessing treatment. That means that 40% are not. We can do better, and we must do better. The imperative is now on us to put the evidence into action. This collaborative brings us together, the leaders in HIV care across the province, to share knowledge and best practices. Through hard work and relationships, we are going to change the course of the disease in our communities. I am committed and I am convinced that working together, we actually can stop HIV and AIDS. Thank you.